My name is Father Steve Blum. I am currently a retired priest from the Diocese of Toledo. It's in northwestern Ohio. And the reason I'm here is Mr. Dangle, professor here at the college, invited me to join him. And I'm visiting him and his wife. And he said, hey, we got this TV show that possibly you could help out. And I said, sure. Taught a class this morning for business school. And so I thought, sure, I'm happy to be here.
Okay. So you're not, the arm's not too sore from being twisted, is it?
No. I figure this is one way I'm getting to heaven, see?
Right.
Right.
Touch a few more people.
Do a few more favors for my friends, yes.
Right. Okay. So a little bit about your background and a part of this holistic.
I went to a seminary called the Pontifical College Josephinum. It's just north of Columbus on Route 23 in Worthington, Ohio. And spent actually 4 years in high school when they used to have a high school, and then 4 years in college, and the last 4 years are called theology. And part of the training in theology is not just academics, but it's called pastoral ministry, where you go out and do teaching, counseling, visiting hospitals, et cetera, prisons, you name it. That was part of our training, our formation. And in the early 70s, Riverside Hospital contacted the seminary and they said, we're trying a new concept. It's called holistic teams. And we'd like some of your seminarians to participate. So the more I thought about it, I thought, well, this is interesting. I'll give it a try. So I was put on a holistic team along with a doctor, a nurse, a therapist, somebody from a social agency, a hospital mediator. I mean, maybe there are a couple other people I can't remember, but it was our responsibility then to work together as a team for healing for certain patients. And so we'd meet once a week and kind of plan out a strategy of what we were going to do, how we're going to do this, and then we were assigned certain patients in the hospital to visit. And basically it was kind of pretty much one-on-one in terms of the team, but what we were doing this together, okay? And then we were comparing it to traditional methods of healing. In other words, the doctor-nurse relationship, therapist relationship, versus this holistic team approach. And then we would follow patients for a number of weeks and visit and do our things. And basically my responsibility was to pray with the patient, talk about any spiritual needs they would have, and make references if I had to a church congregation or whatever. And it made no difference what religion they were, even if they were not a member of a church, which was really interesting for me because I have a Catholic background and I'm used to visiting Catholics, and so to visit people who are not Catholics was very much of a challenge for me, especially as a student in training for the priesthood. But,
so do you use different words for the same things, or what's the difference?
Oh, no. You pray as if the person understands who God is and Jesus. And sometimes people would say, well, I'm not much of a church goer, but I'd say, is it okay if I say a prayer for you? Most people would say yes. On occasion, very rare occasions, I had a patient that said, well, I'm not really into that. So I'd said, well, I'll just say a silent prayer, if you don't mind. And they were okay with that, but they weren't maybe very active in their any kind of a religion or a faith. But
right.
You mentioned spiritual needs when you go to meet with these patients in the hospital. Do you think that people are even aware of what their spiritual needs are? Or what might some of those have been?
It depends on the person, really. In my experience, the experience in the healing team was different than after being ordained a priest and then going to visit people, let's say in the nursing homes or their homes or hospital situations. Many of the people I would visit before they were admitted or as they were admitted were asked what faith they belonged to or what church they belonged to, and so consequently, since I am Catholic in the background, I would normally visit Catholic patients, primarily from my parishes. And some I would know, some I would not know because they weren't very faithful in their practice. But depending on you had to kind of gauge where the person was in terms of their faith practice. The people who were more faithful, it was real obvious, and they were very upfront about their spiritual needs. They'd say, oh, please pray for me, this and that and the other thing, and I've got my prayer group that I belonged to praying for me, and so you kind of pretty much knew what to do for those folks.
Would you have confessions also?
Oh, yes, yes. In fact, one day I visited a man, he said, I didn't know him, he was a stranger, and he said, well, Father, it's been 50 years since I've darkened a church door, but I'm facing a serious heart surgery, and I just thought it might be good to make a confession. So I heard his confession, and normally in critical situations we would also offer another sacrament that we call anointing of the sick. In the past it used to be referred to as last rites, or the original title was extreme unction, which means extreme anointing, at the point of where you have one foot on the earth and one foot ready for the grave. And so the priest would show up and anoint.
You don't want to see that guy at that point,
Well,
especially before surgery. It's like, I want my last rites.
Well, it's funny because when I was first ordained, I would visit hospitals, and I didn't know a lot of these elderly people, of course, and they didn't know me. I was brand new.
And you come in with the collar.
And I come in with the collar, and they were frightened of me.
Yeah.
And I couldn't figure that out.
It's like you're the Grim Reaper.
That means something bad.
They were taught, years ago, they were taught that when the priest shows up, something bad's coming down. And
The doctor ain't telling me everything because this guy's here.
and so I had to reassure them that I was there just to visit them. They're okay. They're doing fine. I'm just here to pray for you, and that kind of a thing.
Yeah.
So.
So I know in my profession as a mental health counselor and addiction counselor, like it's kind of confession in a way. Like people are telling you some of their deepest, darkest secrets, but I also think that there's a healing element to that, but it's also hard on the person that's like hearing it. How do you handle that? Have you ever had any difficulty
Not
with
really,
some of the things you've
I
heard?
always tell people that whatever they say to me is confidential.
Yeah.
Whether it's in the sphere of a confession or just a talk, a private conversation in that kind of a setting, that they can say whatever they need to say. Yeah. And I've not really had a difficulty with that, no.
Right.
So taking on their responsibilities?
Yeah, so you can kind of separate yourself from, you're not hearing anything you're taking home and it bothers you, kind of.
Well, I always worry about people, but it's, I walk out of there healthy.
Yeah.
And I thank God that I'm still healthy, but I keep them in prayer, definitely.
Is there a different responsibility between her and you as far as if somebody told you, say like if somebody told her something, she may have to refer them to like the sheriff's office or to some other professional. And if they told you, you don't have the same responsibility to go get them the help or, report them to someone?
It just depends on the situation. I have a responsibility because I'm not an expert in any kind of a field in terms of counseling. If I sense that this is something that is beyond my ability to help, I have a responsibility to suggest a resource that they might consider. I'll give you a typical example. I was a pastor of a large parish in Lima, Ohio, and also a rural parish, a smaller country parish. And after a while, I began to notice that at the service, the wine that we used for communion was watered down. I thought, what's with this wine? Did we get the wrong wine, or what's the deal here? So I talked to my pastoral leader, who was a woman who was actually in charge of the parish. I was kind of like the chaplain. And I said, where is the wine kept and who has access to the wine? Well, she told me, and the only person who had access to the wine was a maintenance person. And so I said, go check the supply. So she went and checked the supply and found that most of the bottles were bone dry, with a couple who were half filled. And we tasted them and they were watered down. And so we knew this person. So we removed any other wine stock that we had and put it in another safekeeping and locked it up so she wouldn't have any access to it. And then we confronted this woman, and she admitted that she had been drinking the wine and that she had a problem. And then recently, even before that was happening, we found out that she had been working in a Wonder Bread place in town for 11 years as a supervisor, and she came in one day inebriated and she was fired. So she was crushed. I don't know if it's led to her drinking the communion wine or not, but then my concern was, we need to get you some help. And so I tried to set up a meeting with her, and she refused. And I tried again, and finally she agreed to come to a meeting at the small church. So it was on the evening when the children usually met for religious education, and she was actually a teacher for the 3rd grade until this happened, and she just kind of pulled away. Luckily, she had a friend who took over for her, a very good friend, and so this friend confided in me that she'd lost her job. That's how I found out, and then everything started coming into place. Well, I set up this meeting, and she showed up, but she couldn't speak to me. She was just sobbing and just couldn't speak. She was so depressed or
Shameful?
Yeah.
shameful, or I don't know. I couldn't figure it out because she's a good lady. And I kept trying to talk to her and talk to her. So you know, talk to me. And I said, there was a crisis downstairs, so I had to step away for a couple of minutes. I said, I'll be right back. I came back and she was gone. So then I called the police because her friend told me that earlier she was talking suicide. So I called the police right away and I gave her a description of the woman. I don't know where she was going to go. I don't know how she was going to get home or anything. But then I called the mental health agency hotline, talked to a counselor, told him the whole situation. He said, give me her name and number. I will contact her. Well, about an hour later, the police called me back and said, she's safe at home. And then she called me from home and said, thank you for looking out for me. And she wasn't angry that the police showed up or anything. I said, I was concerned about your safety. And I said, and by the way, I talked to this man from the mental health agency, and he's going to call you and talk to you. And I was trying to steer her toward going in and being assessed like they normally do, and then maybe hopefully getting into a program for AA or something, or detox or whatever she needed, but she wasn't, she would refuse. And so this man was very good. He talked to her every single day for weeks.
Wow.
On his own, and helped her immensely. And because some people, maybe they don't need other treatment, I don't know, but this helped her personally.
Good.
His talking to her. I couldn't have done it. It was too close to the situation, and she was a member of the church, and so felt ashamed and all that kind of stuff.
Yeah.
But I couldn't have helped her, but this man helped her immensely. And then I ran into her later at a football game, and asked her how things were going. And one of her boys played on the football team, and she was doing a lot better. She got a new job and a whole bit. So I was thankful.
That's great. That's
Yeah.
great.
Okay, so we're going to take a little break right now, and we'll be right back.
That's a little break.
Welcome back to Body Talk, and we're talking about a holistic way of treating problems or sickness or whatever.
I think it's just a whole integration of a person. There's many components, isn't there?
Yes.
So when you were at the hospital and doing this holistic thing at Riverside, what kind of people would you see? Was there a particular type of patient, or would you see?
They were all over
The whole
the
thing.
age spectrum. Every different kind of condition. Could have been heart conditions, could have been cancer, every different type of patient. There was no special one patient or disease that we were focusing on. They wanted to do a variety of patient diagnoses just to compare it with the normal treatment that people get. And what they discovered over a whole semester, I forget how many weeks that is, but what they discovered through this holistic team approach.
Here it's 16 weeks.
Yeah.
Yeah. Well, what they discovered was that the healing was faster. People were more satisfied with their treatment. It was more personal, more compassionate, and compared it to several other patients in a traditional way. It was remarkable.
Well, I've been in the hospital before, and sometimes you feel like you're just kind of like the bag of bones they keep just sticking stuff into.
Well, you're
You
at
know,
their mercy, definitely.
You're
You're
their
just-
test dummy kind of thing.
Well, they forget about this sort of, you, and they're treating your body, and it's like, okay, your body needs this, your body needs that, and we need to make sure the input and the output's doing what it's supposed to do. Their job's done. and
Well,
they miss some of the other
It
stuff.
depends
Yeah.
on the hospital.
Yeah.
I had neck surgery at the Cleveland Clinic. It was overnight. I stayed overnight. Had the worst nursing treatment ever in any hospital I've ever been in. And they wanted the bed, basically, and so
Yeah.
they wanted to get me out of there as fast as possible. They didn't care that I didn't sleep all night. They didn't care that the guy next to the bed next to me was snoring and I couldn't sleep. And
Right.
Right.
Yeah, I don't usually sleep in the hospital.
but
You better drug me up good.
Right.
it really depends on the hospital. Luckily, I've had a lot of good association with Catholic hospitals, and for some reason, and I can't say it's true of all public hospitals, but in Lima, there were only 2 hospitals. A lot of competition between hospitals, and they really made an effort in terms of how they treated their patients, how they were greeted, how they were treated, and considerate of feelings, that you're a person, you're not just an object in the bed that needs to be treated with whatever. Both hospitals did this, and I thought this is really, really great because I could be in the community where this was happening. But I've been in Toledo. They have many hospitals, and it wasn't so good in some certain hospitals. Same kind of experience you were saying would happen.
So what were the outcomes to what you're doing?
Well, the outcomes of the holistic team, like I said, were the healings of people were faster. Just they were faster, beyond expectations of the doctors, especially. Like I said, people were more satisfied. They were happier, treated as human beings, and just felt the care was better.
Right.
I'm wondering how spirituality fits into healing. Can you explain that a little bit? Like, how does that work?
Well,
And
that's a good
Is there an
question.
answer to that?
That's a
maybe
good question.
comparing to the type of healing that, say, like I don't know if he's a reverend or whatever, Ernest Angley does, where it's the hands-on, boom, healing.
Well,
or-
I would often tell people, I said, if I had that kind of power to really heal people, I'd put everybody out of a job in the hospital.
Right.
Yeah.
So I think spirituality is integrated into everything that we are, okay? And who we are, Genesis, the book of Genesis and the Bible says that we're made in the image and likeness of God, so there's a divine spark of God that lives within us. And so if we can tap into that spark of that presence and power of the Spirit of God, prayer proves that it has power.
You can manifest change that
You can
way.
manifest change. You can bring about things that are unseen. Recently, before we began the show, I mentioned a priest who was in the charismatic movement of the Catholic Church, and he was really big on healing, the gift of healing. And so he made a movie at St. Vincent's Hospital in Toledo some years ago about healing. And what he did is he created prayer teams, and we went around and we would pray for different patients for a number of weeks, and then he would record all this on film to see what the results were. And the results were amazing. And there were some, and then
Did the people know that they were praying?
Oh, yes, yes.
Okay. It wouldn't be like behind
we
the door.
asked for their permission to do
Okay.
that, and they all agreed. And at the end of the experimental kind of period, their conditions were re-diagnosed and checked out by the doctors, and they were monitoring the progress all along. But they said that there were things they couldn't explain. Some cases, disease disappeared, or a ventricle was opened, or something that they couldn't medically explain it. So there's real power in prayer in terms of the healing. That's what the whole movie was trying to show.
So there's been research done scientifically from the medical community, and they can't explain these spiritual aspects.
It probably happens in a lot of hospitals where they have chaplains, and I'm sure many hospitals have stories they can tell where they cannot explain the outcome of a person's condition, because when they came in, it showed this and that and the other thing, and then through the chaplain's intercession, or let's say a prayer group in their community, or family and friends praying diligently on the hour in another room in the chapel or whatever, and this has happened many times too. I remember once again when I was in the seminary, I would visit Children's Hospital, and one day when I came in, I met a whole room full of people who were praying for a little 6-year-old boy who was dying from cancer. And unfortunately, he died, but they had this whole room of people and friends and family praying for this little boy. It was just too far advanced for that little boy, but
So what do you say at that point? You know, you hear the people, well, he's in a better place, and it's like, you know, I hate to hear that, you know, but...
It doesn't seem right.
Right, and I know from my losses that there's really nothing you can say that, like,
well, I tell people
makes
that
you feel better.
it's unjust.
Mm-hmm.
It's not fair.
Right.
You know, who knows what that better place is about? We believe in eternal life; it's going to be better, but it's not consoling or comforting to the family to hear that.
Right.
Or God has a plan. I never say that. I say, you know, so sorry. We're just fragile human beings, and whatever nature is going to bring could affect any of us at any time. We don't know. In my 41 years of being a priest, I've buried people anywhere from a preborn baby to a lady who was 107 years old, and every age in between. Mm-hmm. And I can never answer the question why. You know, I say I'm saving up my questions. If I ever make it to heaven, I got a list of questions that I want to know answers to. So yes,
it is a hard question.
People a lot of times just don't know what to say.
Right, and it's, you know, you get these things on Facebook. You know, sometimes I just get tired of saying I'm sorry for you.
Yeah.
You know, it's just hard
I think
to know what to say.
From a counselor's perspective, I think people just want support. Like, you don't have to say anything, just be there.
Right. That probably means more.
Yeah, because there is really nothing you can say to
well, you can always
comfort
say,
someone.
I'm so sorry.
Yeah.
So sorry.
Right. Just empathize.
Mm-hmm.
Yeah, you empathize. And,
Yeah.
People do appreciate your presence. It's very important.
Yeah.
Mm-hmm.
I remember another program I was in, and it's called a clinical pastoral education program. I was taking as a deacon. Deacon is the year before you become a priest, and so we had a 6-month internship, and I was in a parish in North Toledo, and so for 11 weeks I did this clinical pastoral education course at the hospital, at St. Vincent's Hospital. And you have a supervisor, and there's a team, and you work with in the whole bit. And part of our responsibilities were visiting patients every day. And then we would have a write-up of what happened, a verbal write-up, and we'd check that out with our supervisor. Well, anyway, I visited this man who had terminal cancer. Mm. I walked into his room, I introduced myself, and before I could say another word, he just started crying. And I thought, what do I do? So I just grabbed his hand, and I just said, it's okay. And he cried for about maybe 5 or 7 minutes. I mean, I was,
okay.
Here I am, a
now
newbie. What do I do here? I'm not a priest.
Yeah.
What am I? And so finally I just said, is it okay if I say a prayer? And I said a prayer, and he goes, yeah. And I said, well, I'll see you tomorrow. Well, I came back the next day. There were 2 women sitting in the room. One was his wife, and one was an aunt or somebody, a relative. And he's sitting up in bed, and he's saying, this is the wonderful young man I was telling you about yesterday. I looked behind me, and I thought, who's he talking about?
What did I do?
What did I do? Just the presence.
Yeah.
And to say to him, it's okay. It's okay to feel terrible.
Right.
Because you got cancer and you're going to die. I mean, it's okay. I wish I could help you, but...
And it's okay to cry.
Yeah.
We all have those emotions, you know.
And it's okay to feel terrible.
Mm-hmm. Right. You have to go through these steps. You can't just skip these things, I don't think.
Well, initially, I remember with some of my other team members who were on this clinical pastoral education course, they thought, well, when you go into a room, you're supposed to cheer them up because they're feeling bad, see?
Oh, buck up. You
Hey,
got this.
Oh, you got your arm cut off. Oh, hey, you can always get a prosthetic.
You got another one.
Could always be worse.
Yeah, could be. The person down the way there, oh my gosh, they just had both their legs are gone. No, he'd never say stuff like that.
No. That's covering up why they're there and why they need your help.
Empathy is the big word that you mentioned, and exactly, that's part of the presence.
Yeah.
You try to understand and support their feelings, and let them know that it's okay. So you're angry at the doctor, you're angry at the surgeon, you're angry at whoever, it's okay.
Mm-hmm. Yeah, I worked at Walter Reed Medical Center in D.C. for a year. I was a electronic communication person, but still, I interacted with a lot of other people and met some just amazing people who were patients, you know. Like I taught a blind guy how to watch TV, you know, and just different things because I fix the TVs over the beds and stuff.
What I discovered in a lot of my hospital visits is that many times there's an unspoken or unknown healer on the hospital team that people don't even know about. And it's the person who comes in to clean the room. And I've been in many rooms where this person's in there cleaning, and they strike up a conversation with the person, and because they begin to know them because they're there every day, and it's like two friends talking, and it's like, and I can see the interaction. And it's like, here's a whole nother person that's helping on this healing team.
And you're not the guy that's talking about the sickness. I can talk about other things, you know, so it's not just in your face all the time.
Or maybe they feel more comfortable talking to that person who's a non-medical person about what's going on. And several times, some of these people have been where these people are currently in whatever situation they're in, so they understand.
Okay, well, I'm sorry, but we are out of time. So it's been a great conversation, and thanks for being here.
Well, I appreciate the invitation.
Right, I'm glad Pat could twist your arm to bring you in.
Yeah.
So thanks for watching Body Talk, and we'll see you back here in November.